In today's session, we are going to be having a really vital conversation about physician burnout and burnout in general for healthcare professionals. What does the landscape look like? Going into some definitions, some understanding, and then looking into some tangible solutions for the problem that we currently face. So first of all, just to kind of give a bit more of an introduction to myself and why I feel particularly passionate about this topic. I've just finished my first year of medical school and I'm really passionate about this subject. Already I've realized the importance of a work-life balance and how burnout can really creep up on you. I'm really keen in this discussion to get into the work that's been going on in this area and also talk about some tangible solutions to the problems. So without further ado, I'd like to introduce my three fantastic guests. First of all, we have Faye Bate. Faye is a third-year medical student and a YouTuber who, might I add, I'm going to add this because she's absolutely fantastic, and her YouTube channel has completely changed my perspective on what it means to have a work-life balance, and she's a third-year medical student at Anglia Ruskin University. So, secondly, we have Charlie Cole. Charlie is a clinical psychologist in training, due to qualify later this year after completing his professional doctorate with the NHS and University College London. In response to the COVID-19 pandemic, he established psychological support provisions to promote the well-being of frontline staff at Homerton University Hospital in East London. He plans to carry the ethos of helping the helpers forward by developing tailored support pathways for public sector staff who are at risk of developing mental health difficulties due to the nature of their work, whilst advocating for organisational change and forward-thinking policies that safeguard the well-being of those delivering our public services. And finally, we have Dr. Patty Barrett, who is a preventative cardiologist with a special interest in cardiometabolic health and digital health. And he previously has worked at Scripps Translational Science Institute, California, and Columbia University Medical Center, New York. So I've introduced you all. I hope you're all doing well today. What we're going to do really is have a conversation thinking about burnout and thinking about what solutions we can hopefully have the audience take away from today and really help them with some more knowledge and information about this really important topic. So I guess the best place to start for our audience, as potentially some people may not be aware, but some definitions, some ways of quantifying and categorizing what is burnout, what does burnout look like, potentially from a social perspective, a legal perspective, an economic one. So maybe if I come to Charlie first, in terms of defining burnout, what would you give as a definition for our audience?
Good morning, everyone. Yeah, I'll probably just start with a bit of a definition that we have from the World Health Organization. And we'll probably kind of break this down a little bit today and even critique it a bit. But the World Health Organization really defines burnout as an experience that arises due to excessive demands within an organizational setting. So working in a hospital as a doctor or a nurse. And it's really characterized by having kind of three main symptoms. This would be feeling really depleted, having no energy, or mentally exhausted as well. And also this kind of sense of distance between your job and the values it brings, and sometimes even a bit of cynicism as well, so doubting the impact that you can have for good on your patients. And finally, kind of a sense that you can't really do your job in the way that you would like to. And sometimes people might find that they are able to do their job less, or it might just be a perception and kind of doubting themselves, so to speak. But as I said, this definition really emphasizes the individual and what's going wrong there, and not really looking at the organization as a whole and what might be going wrong, say, within the hospital setting or with the policies that come from the top down.
Yeah, thanks so much, Charlie. And Dr. Paddy, do you have any perspective on that in terms of what definitions would you put to the audience?
Well, I think that is the as outlined, the cardinal definition that have been used primarily in the research settings, which was originally pioneered by Christina Masloch, who really characterized this as an entity. But my definitions, I think, extend beyond that, and I often use the rather kind of edgy definition, similar to Larry Flint when he was running Hustler magazine, for the definition of obscenity, that the judge actually said is that I know it when I see it. So I think we can use very specific terminology, and that's helpful as we assess it within individuals and organizations, so we can have accurate statistics. But for most people, they know it when they see it. They know it when they feel it. And my acid test definition of burnout is that when you walk to the front door of the hospital, if you feel that everything and everyone is in your way of walking straight back out that door again, there's a high likelihood that you're feeling burned out. So we have to be mindful of the specific scientific definitional criteria that we use in the research literature, which is incredibly important to track it over time and to provide frameworks. But there is very much a felt sense of what it feels to be burned out. And I think people will describe it in lots of different ways. But it is very much how you feel about it. And I think it's very clear when someone is experiencing that or not.
Fantastic. Thank you so much. And I'm going to come to my next question, which is, what is the catalyst? How does burnout start? Obviously, this is such a broad question and will vary for so many different people. And I'm going to come to Faye on that. But before I do, I just want to remind our listening audience to please, if you have any questions, comments, or thoughts on today's discussion, please be sure to put those in the chat. And we'll have about 10 minutes at the end of the session for me to put those to our fantastic speakers. So Faye, what is the catalyst? What do you think the catalyst is?
So morning, everyone. So I think what is really nice about who's here for this discussion is obviously we have kind of like 3 different generations. And I guess my perspective would be seeing where it all starts to begin. And even though there's so many like systems in place that make burnout such a problem, I think obviously those systems trickle down to like the attitudes that we have when we first enter these careers. And I guess I've seen it in medical school, I've seen it in the medical social media landscape, this push for almost like toxic productivity. You're not worthy of what you're doing unless you are giving up every single second of every single day to study, to better yourself towards this goal of being a better doctor, a better nurse, a better physio, whatever it may be. And yeah, as I said, I think it comes from these systems later on in life when they put this pressure on us. And these attitudes just have like completely disregard the need for longevity in our careers. And I think there's a really common saying in like medicine is that it's a marathon, not a sprint. But I'm not necessarily sure that people actually understand that that means when you're in medical school, you know, learning how to have a good work-life balance right from the get-go, so that, you know, when you enter life as a junior doctor and things get 10 times harder, you still know that you need to know your limits. You need to know when you're struggling, when you need to ask for help, and you need to put aside time for yourself and away from, your career. And I think it does, a lot of it comes down to competitiveness and this idea that you're doing better for your patients if you are really not looking after yourself, which is completely like not true.
Yeah, thank you so much, Faye. That's a really, really good point. The catalyst, if you like, it starts at the beginning in those training stages of our careers, whether it be in medicine, whether it be in nursing. And the point you made about this kind of being an intergenerational conversation is a really, really good one, because we have 3 quite different perspectives and at different stages in our careers. So I think it's really, really helpful for you to introduce that perspective. Charlie, I wanted to come to you because I know you, during this COVID-19 pandemic, you've obviously been working with those healthcare professionals who on the front line, who we are so appreciative for all of their efforts. What can you say to kind of what you've seen with these people that you're working with? What has been the catalyst for them? Is it varied? Is it similar? What does that look like?
Yeah, it really varies from person to person. And I think also it varies between the different roles. So say the experience of a nurse might be very different to a psychologist like myself, or a doctor, and even a cleaner as well, who's been working on the front line, keeping the hospital safe and secure. Faye makes a really good point that over time, professionals may kind of overlook their own needs. And over the last year, we've been doing a lot of kind of group sessions to support staff. And we've been using something called the compassion-focused therapy model. I'll just kind of explain it in a nutshell. But as humans, we all have 3 different systems of the mind and the body that are helpful to us. They help us to get things done and to survive, essentially. So we've got the threat system, which I'd like to have everyone think of as kind of a red circle. It's the alarm that tells us to keep safe. We've got a blue circle, which is the drive system. It's the system that kind of motivates us to get things done. And then we've got the green circle, which is the soothing system. It helps us to feel calm and rested and relaxed so that we can recharge. Now, all of these are interlinked. So when one is very active, usually the other is less active, and all helpful at different times. But over the last year with COVID, and when I've asked people to kind of picture the size of these circles in their mind, pretty much all of the doctors and nurses I spoke to said that their green soothing system was basically non-existent. They weren't looking at their own needs. They weren't engaging with self-care. And instead, everything they did day in, day out was focused on the other, and also responding to, of course, a really scary situation. So that alarm in the mind and the body was constantly going off. And really, the aim to bring this back down to baseline is just to recognize that and actually take moments of self-compassion and to say, actually, I'm going to look after myself today. And just, even if it's a very short rest, have that. So I think to answer your question, it's definitely an oversight of self-compassion and caring for ourselves as much as we would kind of care for our patients. But as I said, it can really vary. Paddy mentioned something earlier about it's often very visible, but actually sometimes for some it can be really overlooked. There's an idiom that says the experience of burnout and things like moral injury is almost death by 1,000 cuts. It's not one big event. It can be small events that kind of chip away at people over time. And that's really something that the healthcare workers have said to me in the sessions, but also the group sessions as well.
Yeah, thanks so much, Charlie. And I guess I'll come to you, Paddy, kind of on this same question as well, the catalyst, the spark. What's your perspective?
So I think you need to see, as Charlie had been pointing out, the individual in the context of the environment. There is a selection pressure for people who are highly conscientious and empathetic who get chosen to be in the medical profession. So you're dealing with that group as a whole. And so they are sensitive to that. That's not to say that we should change our selection mechanisms. We need the right people who have high levels of empathy to deal with patients over time. But you need to look at the ingredients that we look at for a causal factor of burnout. The three characteristics, as we pointed out, are emotional exhaustion, depersonalization, and lack of efficacy. But when you look at the area of work-life survey, which again is an extension, so to investigate the actual root causes, you need to see these 6 features in terms of a lack of resources, a lack of community, an absence of fairness, the increasing loss of autonomy, and this idea of a value conflict, this moral injury, this idea that your individual ethos does not align with the organizational ethos that you're in. And I think we had seen a really serious acceleration of burnout figures over the last 10 years. It began to plateau in the last several years because of the increased attention, but then has just reignited. Because if you look at those 6 features, those 6 ingredients, you can see that the COVID pandemic has really pressed hard on each of those levers. So what's also important is each environment, whether you're working as a nurse in an emergency department or a doctor in a dermatology or psychiatry department, you will have different areas of stress. And this is important to realize and goes to the individualized nature of how people experience it. Some people are much more sensitive to the idea of a value conflict. Some people are much more sensitive to a reward conflict. And that's not a reward to do directly with money. It may be to do with praise or time off. And also the lack of autonomy and control in terms of the ability to direct how you're going to deliver resources. So I think you need to look at it in the context of what matters to you, what is likely to be at risk in that environment, or kind of where the pressure is likely to come from. And that really then speaks to how you think at an organizational level, where you will direct attention and resources. But one of the most fundamental things I think is really important to outline at the very start is that burnout is a symptom. It is not an underlying problem. So that is something that we need to be mindful of, because in healthcare, you can't cure symptoms. You need to cure the underlying problem, which is why we need to understand the root causes. And humans, by their very nature, particularly those who get selected to train in healthcare have a high degree of conscientiousness along a personality scale and are susceptible to a concept called a fundamental attribution error. So when something goes wrong, they are highly conscientious and likely to blame themselves rather to understand and think about how the environment has actually changed, which is why when clinicians are often asked to engage in a mindfulness or meditation practice, they really bristle at that response, because that does not actually change the underlying architecture of the environment and ecosystem. It really is trying to just ameliorate symptoms. So we need to see all of these factors integrate together over time.
Fantastic. Thank you so much, Paddy. That was a really important point that you made there. The next thing I want to come to, because I think it's important, especially for obviously those who are in the field that we're discussing of medicine, but also the general public, which is, how does burnout manifest itself? Part one of my question. And then part two of my question is, where are the solutions? What are the solutions on a micro scale, potentially within your family, within your peer group, and then on a macro scale within institutions and organizations? So I suppose I'll come to the first part of my question, and I'll take it back to Faye. What do you think of this particular?
Like, how does it manifest itself?
Yeah, how do we, what are the signs, what are the telling kind of things that somebody who maybe has a family member who's a healthcare professional, or well, that's their peer group, is there a way of noticing it?
I think in periods in my life, I think the reason I would say that I have such a good, now I have a very like holistic view on, you know, how to balance my time and how to make sure that I'm always like looking after myself, is because, you know, I was the classic student in school who just would would work for hours and hours and hours, and I always wanted to do the best in all my exams, whatever, and then I hit a point where that just wasn't possible anymore. And, you know, that is a very different style of burning out to someone who's been working on the front line of a pandemic, and, you know, they're very different things, and obviously my experience is different to other people's. But I would say the times when I knew that I wasn't in a good space to do the best that I could, it was things that, like, I just had no motivation to do anything, no motivation to seek help, no motivation to see my friends, no motivation for any of the things that I enjoyed. It was fatigue in every aspect of my life, and not having the willingness to try sort that out, if that makes sense. And as we said, you know, it manifests itself in so many different ways for different people, but personally that has been my experience.
Yeah, thank you so much, Faye. I mean, even for myself as a medical student, I found that experience specifically, that lack of motivation, that kind of inability to be able to see a way out, to see a way that I can change the current situation. Charlie, how do you feel about, again, obviously you were on the front lines last year, helping those who are the helpers, if you like. What did you find specifically that was manifesting itself in quite a few people? What were the signs?
Yeah, I think Faye and I had a bit of an interesting conversation earlier before this, and one thing we really agreed on is that sometimes burnout can happen when we just entirely forget that we are human, or avoid being human, in the sense that we're not invincible. We can all make mistakes, but sometimes we just continue to push ourselves and really forget that. And as I said earlier, I think when we start to no longer have self-compassion for ourselves and even for others, so we might no longer care about our patients as much as we did before, but also we might no longer accept compassion from other people, and we kind of close off from ourselves, from others, and just really start to deny that we all share. We all have a common humanity. We're not all invincible, as I said. And I think when that's really forgotten, I think that's when burnout can really manifest, and that really will look different in different people. As Faye said, it might be really limited motivation. But I think it also has to be said that many healthcare workers I've been helping have responded by actually working more and trying to push through it to kind of manage these feelings, and especially those ones that Paddy and I mentioned earlier about this perception of not doing well anymore. And to manage that, people might actually just go extreme lengths and doing as many shifts as they can, but that just keeps the problem going. So yeah, I would really boil it down to kind of just forgetting or avoiding that we're human beings, basically.
Yeah, no, that's a really great point, and that response of choosing to work more when you're feeling that way is a fascinating observation. So now I'd like to come on to solutions, which I think are going to be the most important part of this discussion for our listening audience and for obviously the group of people that we're speaking to today. Before I do, I've seen some great questions coming in. I want to remind everyone, please keep your questions coming in the chat. And in the final 10 minutes, I will be putting these to our guests. So Paddy, I'd like to come to you first in terms of solutions. What are maybe 2 or 3 examples of solutions on an individual scale, in a smaller peer group, and then also with bigger institutions?
So I think you're correct insofar as you need to separate this into individual strategies and organizational strategies. And there's some really good literature on that all of these strategies are useful, but they have disproportionate effect when applied at an organizational level. From an individual point of view, I go back to the Nietzsche line on this that's echoed by Viktor Frankl in Man's Search for Meaning, a crucial book that shaped my thinking on this, is that he who has a why can bear almost any how. And I think when we are going through medical school or any form of training, the why is incredibly clear, and we are highly motivated to work at a very high level and endure a lot of hardships. What's happened over time is that I think our perspective of the why, our motivation for doing this has diluted and diminished. And particularly when you project into the future, again, you lose autonomy and control of where you see yourself in the future. So your motivation to endure becomes less. I think that is if you keep your vision along a single line, and you have to remind yourself what you're doing and why, and how you would like to express that in the world. And so there's 2 ways, and this is somewhat of a glib way to say it, is that you can either change your attitude or you can change your geography, or both. But if you haven't done that after 6 months, you need to ask why you're still in the same position, because sometimes if you're, say, a medical student, you don't get the option to change your geography and leave, or work in a different domain of healthcare, or work in an area outside of, say, clinical-based practice. So you have to say, how can I make my immediate environment much better? How can I lean into the problem? And by leaning into the problem, you begin to restore autonomy. And that is why sometimes working harder, but not only harder, but smarter about, if you work in a particular department, a division, a medical school, how can I make my medical school, how can I make my particular division or team the best team that there is? And you're not going to change the actual government level imposing structures that are going to dictate many of the things at a hospital level, but how can you change your micro environment? How can you actually look at your team, your individual group of maybe 6 people who are working on a medical team, everyone on the floor, on the ward, on that service. And when you've, I think, deeply reflected on understanding and thinking again about your why, the how becomes much more manageable. Because if you don't have that direction, if you don't have that deep understanding and motivation for the why, any how becomes impossible. And therefore, that is what happens when you see someone kind of retract back into themselves and say, I'm not even going to attempt anything. I don't want to even move from here, because there's no directional valence as to the why. And again, it is a Viktor Frankl line, insofar as to act normal in an abnormal situation is abnormal. So we need to see that a lot of the healthcare ecosystems and environments have become abnormal, and our responses to them are entirely normal responses. It's really unfortunate and it's very disappointing, but we have to make decisions. We can't say, why me? We have to ask, what is next? And what am I going to do next? And for most people, it will be about leaning into the problem within their local organizations and infrastructures. For some, they will go to higher levels and change the organizational structures, and potentially even at a governmental level. But for some people, it means working in a different domain of healthcare and adding value to people across different domains. And that might not be in the classical patient clinician facing structure. And so you have to ask what it is that you want for yourself. So So for me, it's a focus on the why, and also then really trying to work very hard at the microstructure environment.
Thank you so much for that, Paddy. Some already tangible solutions of what we can do just in our small groups of people, making that decision to say, I'm going to try and do this for my peer group in order for us to feel less burnt out, to deal with some of this, like you said, that burnout is a symptom, to be able to deal. It's a symptom, but it isn't the underlying problem. So I think that sense of having a peer group, it leads into having a community of people as well to support you in those situations. Charlie, I'd like to come to you next in terms of, again, said it before, where you were, kind of working in real time on a real solution. What have you found in terms of the results of that? How transformative has it been for the people you're working with?
Yeah, I think this is a really difficult question to answer, just largely because I think until probably very recently, and certainly after COVID, burnout hasn't really been taken that seriously. And in many ways, when we've been offering support to healthcare workers, it's felt like laying the tracks before the train has come. We're trying to offer support to people without fully understanding what's going on for people, especially with COVID. It's just brought so many new challenges that we've rarely really seen in the UK. So there's been a whole lot of uncertainty. But as Paddy said, we need to work with the individuals, but also the systems. And we can break this down into kind of primary prevention, secondary prevention, and tertiary. Primary being preventing burnout from happening. And with that, we need to change the system, have fair policies in terms of the remit people are actually working within. And then secondary prevention is all about supporting people when burnout is starting to emerge or after something that could lead to it. So, for example, wave 1, wave 2 of COVID. And there's a few things like psychological first aid that you can do to support people when they're in that initial phase. And then moving into the tertiary prevention, it's about working with the individual. So I've been offering things like cognitive behavioural therapy or CBT or other forms of psychological support. And I think we just need to have all of those three measures in place. And really the focus has only been on, say, the treatment phase rather than the prevention. The Minister of Health is, I think, speaking at CogX maybe, I think it's tomorrow. It's just really interested to hear what he has to say about what he's doing for burnout kind of amongst healthcare staff. So yeah, I think we've got to work across those three things. And I think we need to actually just accept and realise that burnout is a problem before we can fully realise that. And secondly, we need to be sensitive to the fact that there's different intersectionalities of social identity. So ethnicity, sexual orientation, and how belonging to a minoritized background could actually make this experience of burnout much more difficult for certain people, and offering forms of care that are sensitive to that.
Yeah, no, fantastic. I completely agree with that, Charlie. Thank you so much. And lastly, Faye, I wanted to come to you on this question, but with a slight spin on it, I suppose, because obviously you have a YouTube channel that's super successful and kind of talks to that idea of a work-life balance. So in general, what do you think the role of YouTube and other social media platforms is in having this discussion? How powerful can it be?
Yeah, so I guess it comes kind of a little bit back to what Paddy was saying about how, like, changing your environment or your geography. And I think when we think of environment, we think of maybe, say, medical school or making little changes in that environment. But I think it also comes down to the culture surrounding a profession. And, something that I saw was this culture surrounding even not just medical school, like study, social media could verge on being quite like toxic sometimes and pressurizing. And, this age of social media, it's an incredibly dangerous tool, but it's also an incredibly powerful tool. And everyone has different skill sets, but that is whether it's, arranging like some sort of football team at your medical school so that you've got that outlet and you've got that time to just connect with each other and create that community, or whether it's making YouTube videos where you're advocating for mental health and self-care and work-life balance, then both of those are beneficial. And it's just, if you're in a position, I'll go back. What I was talking about before, about how burnout to me was not having the motivation to do anything. And I think it can be really powerful if, when you feel good in yourself and you feel like you have the energy to make a positive impact for you, but other people are struggling, or you think that there's a system in place that may cause people to struggle in the future, then that could be a really good opportunity for you to make a positive change. And, you know, like I said, whether that's making a football team for the people on your ward, or like making a social media account promoting positive messages, then they can both equally change that environment and make it a more positive and like successful community.
Thank you so much, Faye. That was a great answer, and a nice round off to this section of our discussion. With 10 minutes to go, I'm now going to head over to the chat and just kind of pose some of the questions that our audience have put to us. So the first question, I guess there's about 3 or 4 questions here, so I'll come to each of you on a different one. The question here is, what do you advise to do to address burnout if you feel you have it, even if you don't happen to be working within the medical profession? So I think I'll come to Charlie on this one. What do you feel, what is your answer to that question?
I think the first thing is just to tell yourself it's okay. Like, it's okay to have moments when you don't feel so good. But then secondly, very important then to speak to others and to open up about how you're feeling and to seek the support. I think sometimes it can be a very insidious process where people just tolerate burnout for so long. And the longer we do that, the worse we can feel later down the line. As I said earlier, it can feel like death by 1,000 cuts almost. So I think step one is to recognize it in ourselves and to tell ourselves it's okay, but I'm now going to address it. I think Paddy kind of mentioned that earlier as well, that recognizing it and seeing it as the symptom is one thing, but then you've got to address it as well.
Absolutely. Thank you so much for that, Charlie. Next question I've got here is there any survey about burnout and depression in healthcare workers comparing between the normal situation, so pre-pandemic, and during the pandemic? And then subsequent to that, there's a follow-on. Is there any supporting system for the healthcare workers if they confront with any mental health issues, and does that system work? Is it effective? So Paddy, I think I'll come to you on that question.
So obviously it's early days in terms of looking retrospectively, but the directional evidence so far, specifically, I know within the cardiology community, is that burnout rates have increased significantly. Again, if you go back to the 6 etiological factors in the area of work-life survey, all of those have been tackled very hard in terms of our excessive workloads, absence of fairness, value conflicts, loss of autonomy and control. All of those particular domains have been kind of put under extreme pressure. So an increase in burnout is entirely understandable in terms of what has actually happened. I think when we speak of burnout and when we speak of one of the natural consequences is this discussion around resilience. And we need to focus less on resilient individuals, but more on resilient organizations. And so I think COVID has been an incredible stress test on the organizations of healthcare around the world. And although that has pushed it to the absolute extremes, I think it has identified specific weaknesses that I think we can confront over time in terms of where things really failed, in terms of supportive staff, in terms of redundancy of staffing and kind of issues of sickness. So I think that this has been an incredible opportunity to stress test the system, to define where we're weak and where we need to do better. And as I said before, that's going to be different in an emergency department versus an ICU versus a dermatology department versus primary care. So I think we need to look at it that way.
Absolutely. Thank you so much. And then in terms of the second half of that question, I suppose I'll take it to Charlie. Is there any supporting system for the healthcare workers if they, present with mental health issues, and does that system work? And I suppose in a way, I'd like to phrase that question so that might be a good way for the audience to visualize it. Like, let's say, for example, I'm a healthcare professional who's feeling burnt out. What would be the steps that I would take in real time in a hospital in order to get help with that particular situation?
Yeah, I think step one is that conversation with yourself. So recognizing it within you. Step two is probably to see if you can speak to your supervisors or those in leadership positions to let them know how you're feeling. And then I guess step 3 and 4 is going beyond that and accessing services. And in England anyway, recently there's been the development of something called a Wellbeing hub, and these are attached to kind of various trusts and the hospitals working within them, and it's a service that basically screens healthcare workers and recognises their needs and then signposts them to different forms of support, whether that be individual or kind of group support. You can also refer to, in England anyway, primary care mental health services, so IAPT. And that's where I've been working over the past year. In Hackney, we've developed a tailored and prioritised pathway for anyone working in health and social care. And then within that, we've been offering these different forms of intervention. As I said, secondary prevention, which is after those kind of acute episodes that might contribute to burnout, and then prolonged support as well over this kind of more recovery phase. So I think, those are the kind of main steps. It's having that conversation with yourself and then addressing it and kind of moving forward to actually accessing support if you need it. But as I said, it's very much a matter of laying the tracks before the trainers come at the moment. And it's a very new field, which I think is a massive shame, because we shouldn't have waited till a pandemic to have these sorts of support structures. And they only are really emerging now.
Fantastic. Thank you so much. That was a really great answer, Charlie. I'm now going to come with the last question, and then I'm going to hopefully come to each of you for just like a 45-second summary of what we've discussed today. But Faye, this question is for you. What, in your opinion, what are the best ways to prevent burnout and depression? And will there be any technologies or tools potentially in the future that can help people maintain their mental health status and keep it in good condition?
Okay. So it's a very, a broad topic, and if there was like one way to prevent things, then we wouldn't have like this issue. So I think it's quite complex, and I think coming back to what Paddy was saying about having like resilient people and resilient organisations, when we had our conversation a couple of weeks ago, I really reflected on that, because I think there is a lot of emphasis on creating resilient people, and I think we all kind of know what we need to do to be resilient. We need to create good support networks, we need to make time for ourselves, make time for self-care, address issues when they arise and make that known to the people around us. But actually, I would say when we had that conversation, I reflected on, is there anything that you can do to create a more resilient community or more resilient organisation? And I think the question above that was talking about medical school and what you can do, say, in medical school, if that's something in preparation for maybe your career in medicine. And I think something really important that you can do is be an advocate when you have the energy to. And if you see a situation arising that you don't think is fair, to speak up and to address that. We've had so many situations in our medical school, especially over the pandemic, where the expectations we have felt have been completely unfair given the impact that COVID has had on our education. And these people in our year have got together and they've written letters to the medical school, had meetings with the medical school, and been able to make positive change that has impacted our medical community, and that will prevent us from problems arising in the future. And I think if you can get involved in things like that when you're at a lower level in your career and you have that energy, then when you say you step into the NHS, you step into a hospital and you see systems starting to arise, then you will feel a lot more confident in voicing your concerns and potentially making a positive change that can impact more people than just, practicing self-care just yourself.
Fantastic. Thank you so much for that. That was a nice, rounded end to our discussion. I'll very quickly come to Charlie and Paddy for 30 seconds of what you want the audience to take away from this discussion. So, Charlie.
Yeah, I think building on what Faye said, change is a ripple effect. We have to make small changes first, work with others, collaborate, and then see those ripples get wider and wider. So I think that's a great point. I think building on that, we need to amplify lesser heard voices and make sure that care systems work for everyone, recognising what Paddy was saying earlier about tailored support for different teams and the people working within them. I'm going to go back to my point earlier about self-compassion. We need to recognise and appreciate common humanity and that we're not invincible. And what else? And I think it's just I think it's great that we've had this conversation today, and I think it's a good example of how, you know, that ripple effect can start. And so thank you for having me.
Thank you so much, everybody. Unfortunately, we're just out of time. Paddy, if you could give us maybe 10, 15 seconds, just a summary of how you feel about today's discussion.
All I would say is lean into the problem and not away from it. I know we want to try and help ourselves, but start by helping someone else and it will get better.
Fantastic. Thank you so much, everybody. I hope that the audience have taken something away from this really important conversation, and have a good day.